Good afternoon or morning, depending on where you're logging in from. My name is Megan Hotelling, and I'm the Community Engagement and Events Manager for Aquifer. This is the third of 3 sessions on formative assessment and coaching. If you haven't joined us yet on this platform, it might be one that you're unfamiliar with. To give you the best experience possible, we encourage you to engage in the chat like you're doing and to post your questions in the Q&A. You have the option on the bottom right-hand corner of your screen. To activate closed captioning from your computer, click on the up arrow next to the microphone and slide the toggle on. Or if you're logging in from your phone, click on the small keyboard button next to the emoji icons along the bottom of your screen. And if you're like some of us and need to increase the size of your slides, you can do so on your own screen by hovering your mouse over the top right-hand corner of the slides and clicking on the plus sign. Today, we're also going to be using some poll options called Slido. And so when it's time, you'll see a little green circle with an S on it. Looks like a Skittle at the bottom right-hand corner of your screen, and you'll be able to use that to participate in the polls. I'd like to introduce our presenters for today, Kim Tartaglia and Cindy Lord. Dr. Kim Tartaglia is a professor of medicine at the Ohio State University Wexner Medical Center, where she serves as academic program director for the Med 3-year program, director of the I'm Well program for internal medicine residents, and director of faculty mentorship. Her expertise includes undergraduate medical education, performance coaching and mentorship, physician well-being, and lifestyle medicine. Dr. Tartaglia is also a founding member of Aquifer's peer trainers and the current editor-in-chief. The peer trainers are a special board within the Aquifer Consortium designed to support programs with tools and professional development aimed at improving the adoption and use of Aquifer's content, assessment, services, and other resources. Cindy is a well-seasoned health professions educator and dedicated Aquifer volunteer. She has served as an associate professor at Case Western and founding director of their PA program. At Aquifer, Cindy has spearheaded key initiatives, including the PA Task Force and Peer Trainer Board. She was instrumental in developing Aquifer's Anyone Can Coach framework. And now I would like to turn it over to our presenters.
Thanks, Megan, and thank you all for joining. I'll be advancing the slides, but I want to talk to you about the first webinar and remind you that that was where Joe and Nicole first introduced you to formative assessments, how to maximize their success and avoid common pitfalls. And then in the last one, Joe explained really the role that coaching can play in shaping student learning. They introduced a practical coaching framework called Anyone Can Coach that Aquifer had developed. But we know that the peer trainers have received feedback that it's still overwhelming. And so we really want to distill it down to a single page script and help kind of revisit the implementation of both formative assessment and coaching. But first, let's remind you where coaching fits in an Aquifer system. So Aquifer's intent is to really build a holistic learning system where students are given clear direction, the targeted learning opportunities, and formative assessment. This is deliberately connected to Aquifer's cases. And Aquifer's cases aren't intended to stand alone, but rather be integrated into a curriculum with both engaging didactics and patient encounters. And so as medical educators, we envision a system where meaningful feedback and supportive coaching are available to all students, and really relevant data is delivered promptly to them, which is why Aquifer chose to invest in formative assessments. We think formative assessments can have a significant impact on learning. And as the quote says here, when done thoughtfully, it can be a catalyst for growth and development, reducing uncertainty and leading to more focused and efficient gains in skill and in knowledge. But for formative assessment to have this impact, we really need to meet 3 conditions. First, it needs to be low stakes, and that means avoiding using it for judgment. Also, the purpose is to generate feedback to help improve the knowledge, skills, and attitudes of our learners. And third, it needs to empower students for self-regulation and for reflection. Among the most common pitfalls that has been discussed at a previous webinar is that when we use formative assessments to then sort, evaluate, or judge students, it really does lose its value. And formative assessment is vital to creating and developing kind of a master adaptive learner and adaptive expertise, which is defined as the ability to apply foundational knowledge efficiently and innovate solutions to novel problems. Adaptive expertise is crucial because medical knowledge is expanding exponentially, much more quickly than we can keep up as clinicians. And so the goal is for our students to become master adaptive learners that can use that metacognitive, self-regulated learning to adapt their clinical expertise. Just a couple of years ago, I was working with a medical student who was up on the literature for SGLT2s that we use for type 2 diabetes and the benefits for using it in patients with systolic heart failure. And he really pushed our clinical team, including the interns and residents and myself, to consider starting that in the hospital, and not waiting because really the evidence was there. And I thought that was a great example of him taking some knowledge and really, helping push us out of our comfort zone. Becoming a master adaptive learner is a process that starts with planning. The process includes finding strengths and gaps in your competence, and then identifying appropriate resources to address these gaps. Really, that self-directed learning that I feel like, at least in medical schools, we struggle with. For students to fully develop a master adaptive learner, they need high-quality information about their strengths and weaknesses. And here, as Bill Kuchar notes, assessment data is the biggest stream of information that launches the master adaptive learner process. In this way, thoughtful formative assessment initiates the metacognitive habits required and supports self-monitoring, goal setting, strategic planning, and deliberate practice. And so our aim with Calibrate is to provide this type of insightful, constructive feedback to promote the development of adaptive expertise. How does assessment data fit with coaching? Coaching is like the dial, I think of, that turns up the volume on the characteristics of adaptive expertise, making growth more efficient. And so coaching can really enhance the curiosity-related behaviors, the resilience, the motivation, the growth mindset, and that sort of metacognitive learning process. And from the coaching literature, we know that coaching has the additional benefit of improving well-being outcomes, such as job satisfaction, emotional well-being, stress reduction, and work-life balance. Just recently, this fall, I was advising a fourth-year student on the residency application process. And in our meetings and our subsequent conversations, I noticed sort of this interesting narrative that was increasing in her mind about anxiety, spiraling into fears of unmatchability. And it prompted behaviors that were, requesting a lot of changes to her grade paragraphs. And at first, I wanted to tell her that that's not necessary, that she need not worry. I really paused and put on my coaching hat to really express curiosity about what she was going through and what was truly driving her behaviors, to see if my sort of inclination was correct. And through these conversations, she was the one who realized that she was putting too much energy into fueling these anxieties about not matching, and able to identify kind of mechanisms to recognize those when those happen. In the chat, Megan, if she hasn't already, will put the handout summarizing this information regarding coaching impact. So it can be confusing to know what coaching is, and it seems daunting, I think, for us as educators to say, okay, now we have to learn another skill set in order to work with students. But really, in the last webinar where the fundamentals of coaching were described, we can distill it down to just a couple of different tasks. And I'd like to show you that actually, as a coach, you're doing very little work, although the work you're doing is quite subtle. So if you want to know, if you're coaching versus advising or mentoring, ask yourself, who's the expert? Who does the work? Who does the talking? And for all three of these, the answer should be the student if you're coaching. If the coach is depending on their expertise, is doing the work or doing most of the talking, then it's not coaching. That's when we've reverted back to mentoring and advising. In coaching, students direct the learning while the coach facilitates through questions. And so this is, again, a subtle skill set, but introducing you to a framework that is intended to make the process, I think, a little easier and more educator-friendly. Anyone can coach is what Aquifer has called this framework. And really, we're trying to simplify it to 3 steps: evoke awareness, facilitate growth, and foster accountability. And the purpose of this framework is really to focus coaching on the actions most likely to impact learning and equip educators with tools and resources that prepare them to do the active listening and deploy some effective questioning techniques to help learners gain that self-awareness that we so desperately want them to develop. It also helps the learners set achievable goals and stay focused. So for the remainder of today's webinar, we'll divide it into two parts. First, I'll discuss Aquifer's Calibrate formative assessments as a way for students to gain insights into their strengths and gaps. And then Cindy will discuss a simple coaching script designed for use with formative assessment data. And as we move into formative assessment, I'll ask Megan to put in a polling question. I'd like to know from you, what do you see as the primary benefit of formative assessment in health professions education? And so we've given you some choices there, or you can put something else in the chat.
Okay, Cam, I know that you can't see the screen, so I did put the poll up there. It's on the bottom right-hand corner for folks. It's a little green circle, looks like a Skittle, and you can answer the poll question there. It should pop up. I see people. Let's see. People are chiming in. We have 8 responses. I'll give it another second. Okay. So winning by a landslide, the response identifying student strengths and weaknesses at 73%, coming in at 18%, encouraging self-directed learning. And I think people are popping some answers into the chat as well.
Great.
Marcy says, understanding their thought process. Hey, Marcy.
Great. Now, all of those are great. And there's not one right answer here. We really think that the importance of formative assessment is to help catalyze our learners as master adaptive learners and really encourage that self-directed learning process, which starts with identifying strengths and weaknesses. So thank you, Megan. If we earnestly expect our students to engage in the master adaptive learner cycle, they need something that initiates the planning phase or motivates them to reflect on their strengths and gaps, as we just talked about. And one of the best tools to encourage students to engage in a cycle of learning is formative assessment, because it embodies that spirit of assessment for learning instead of assessment of learning. Formative assessments offer feedback and guidance, fostering self-regulated learning and informing a self-assessment. And what qualifies as a formative assessment is more about how it's used by the student, the educators, and the program. So if the assessment encourages self-reflection in students that are planning, then it can operate as a formative assessment. Calibrate can be used twice during the clinical experience, and once at the beginning and once at the end. So you can kind of see here the time in the rotation. The early assessment starts in the planning phase with the aim to gain insight into a student's strengths and gaps. Then a student will meet with a coach to help identify and prioritize their learning. More on what happens in a coaching session in a moment. But during most of the clinical rotation, the student is in the learning phase. Then near the end, preferably with some time before the final exam, the student takes a late calibrate assessment and again meets with a coach. This coach helps the student clarify their strengths and plans to continue learning. And so this check-in is an important step for the student to not only see their growth, but see their future opportunities. Let's briefly discuss the coach and the student's responsibilities during this process. So in your handout, we have a lengthier description of the responsibilities for each participant, but this slide summarizes the key responsibilities. Here, the coach and the educator roles are represented on the right side of the slide. And note that more than one person can cover these tasks or responsibilities. One person may schedule or communicate the importance of the assessment, while the role of the coach can be a completely different person, however it works best at your institution. Now, we recognize that students can't initiate a Calibrate assessment, so the educator must do that. If you want any support on getting Calibrate scheduled, then you can schedule a meeting using the Calendly link that we'll put in the chat to get that done. Regarding student responsibilities, notice that they're expected to do more of the work in this model. Again, assessments take approximately 60 minutes for internal medicine and family medicine, about 45 minutes for pediatrics, and 20 minutes for radiology. And then we anticipate students needing about 20 minutes to develop their learning plan. first step is for a student to really set aside time to complete the Calibrate assessment. Since Calibrate is designed as an assessment for learning, the resulting data are aimed at providing information to students to help prioritize their Aquifer coursework, patient care experiences, and their studies between now and the next assessment. The assessment utilizes board-style questions that also includes the feature of requiring a student to respond to how certain they are about that knowledge, and asking them to state their certainty really does allow us to increase the amount of information about their cognitive competence. The data generated by the Calibrate system is then available for the student as soon as they complete the assessment. The student receives an email with a link to dashboards that allow them to efficiently and effectively analyze their results. The screenshots on this slide show a series of tabs the student sees in their data display. The visualizations are simple and meant to provide the student with information about their overall performance, their performance on individual learning objectives, their performance by type of decisions such as diagnosis or management, and how certain they were on different items. Now, I'll ask Megan to put up a polling question again. How do you typically review assessment results with students? For those of you who meet with students and do this, do you do it on your own? Do you do it together? Do you ask students to review it on their own, or do you use some other approach?
Okay, polls back up. And wait till we have a few more responses. Okay, they're still coming in, but primarily the biggest response is on my own, then with the student. And additionally, 25% said other, so we might be seeing some stuff in the chat. 13% said together during a one-on-one meeting, and 13% said students review on their own.
Great. So with this type of system, the beauty of it is that the students can share it with their coach. And so it gives you an opportunity to review it before a meeting and then one-on-one with the student if you can. Thanks, Megan. Let me know if anything else comes through the chat. The Calibrate system also includes kind of a learning plan and a template for building that learning plan. The tool scaffolds the process for students to analyze their results and plan their learning. Once the plan is completed, students have the options to share that plan with a learning coach. And so this learning plan is designated to be a starting point for a conversation that you can then, refine the process and refine their planning. Not necessarily meant to be a tool to evaluate the student. In an ideal scenario, the student would share their learning plan and their summary data with someone they trust to provide coaching and guidance on their learning journey. This could be a clinical educator, preceptor, a faculty mentor, or tutor. Upon receiving the learning plan, the coaching conversation then could be scheduled with the student. If the student does not analyze their data or spend some time reflecting on what they want to focus on, the coaching session is typically less effective. And so sometimes the coach or the educator is needed to walk them through that process. When we say the student does the work, this is the part of that work: taking the assessment, analyzing the data, and then creating and sharing a learning plan. So I'm curious your experience, and so I'll ask Megan to put up one more polling question before I turn it over. Are students in your program currently required to develop and share a personal learning plan during their clinical experiences?
Okay, poll is back open. And responses are coming in fast this time.
It's easy. Yes, no.
Yes, no, sometimes. I'm not sure.
I'm not sure.
All right, give it another second. Going back to the last poll, Kim, Marcy mentioned for her, it depends on the setting if I'm in clinical with them in didactic or sim lab.
Great.
I wasn't able to read it because I had taken a bite of my lunch, so I apologize for that.
No, that's really respectful that, depending on the location and setting, you might take a different approach.
Okay, so out of the 10 people who responded in this poll, 40% said, I'm not sure.
Okay.
30% said sometimes, 20% said no, and 10% said yes.
Thank you for that. I think there's a lot of different ways to do this, and certainly Calibrate is one way to allow you a formalized approach to having a learning plan. At my institution, we do have a kind of a personal and professional coaching program that goes through all 4 years. And every time a student meets with their coach, they now have a goals and plans assignment to really submit. And it's really not about what's in that learning plan or that goals and plans assignment, but it is an expectation that they do it every time. And we hold their hand for that because they have to sort of develop it after their coaching meeting. This is a nice way to really put the onus on the student ahead of time, to prepare for the coaching meeting. So with that, I'll turn it over to Cindy to discuss the coaching script designed by Aquifer peer trainers to support the coaching conversation. Cindy.
Well, great. And good afternoon, everyone. And thanks, Kim, for that great discussion around the purpose of formative assessment, Calibrate, and how to get the most out of it. So now we're going to talk a bit about coaching for learning and using the coaching script designed by our peer trainers. So last week, the importance of relationships in coaching was discussed, and the key elements for a successful coaching relationship are promoting learner agency, genuine interest in the learner's needs, of course, creating psychological safety, and then finally balancing authority with friendly behavior, which can probably be quite difficult. We did introduce the 3-part anyone can coach model for effective coaching. To review, first, it's evoke awareness. So here we use active learning and powerful questioning to facilitate learner self-reflection. This helps learners develop a strong awareness of their strengths, gaps, and goals. Next, facilitate growth, where you collaborate with learners to prioritize focus areas and create learning plans. And then you guide them to set achievable goals based on those priorities. And finally, foster accountability. Support learners in setting deadlines and making their plan public and then following through. And we offer accountability through check-ins. The Anyone Can Coach model equips educators at all levels with tools to coach learners in developing skills as master adaptive learners. Last week, we shared an extensive handout with prompting questions, learning strategies, and principles to foster accountability. This week, we're going to share a script. But before I do that, let me share an idealized coaching session based on what we talked about last week. So this diagram, which is available in your handout, represents an ideal 30-minute coaching session. It demonstrates key features like open-ended questioning, student-driven conversation, and prompts that encourage student responsibility. Of course, real coaching conversations are often a lot messier and influenced by many variables. This idealized session is not meant to be prescriptive, but rather aspirational, a structured example of what we aim for in effective coaching relationship. The Anyone Can Coach framework and coaching script we provide are intended to be helpful starting points and guides, but don't get bogged down trying to mimic the perfect session. No one achieves perfection. So let me stop for a second and just give you a quick little story of a real coaching session that I had that was a bit messy, but it was still meaningful. So I met with a student who came in for a coaching session, and they had multiple resources and advice from students. I think every student in their class and every class ahead of them and behind them. Also, they had recommendations from every faculty member, including the recommendation to read more, which I'm not sure what that ever means. They were unable to identify a successful learning strategy, and they couldn't differentiate between a learning plan and a test-taking strategy or test-taking plan. And so they were just all over the place. So I figured, well, let's just start with the fundamentals of coaching, which is stop for a second. I said, these are all lovely things, and you've got a lot of tools in that tool belt. But let's start with you. You are the expert here, not me, not any of them. You're the expert. Just for a minute, tell me, what are your most successful tools? Where have you been most successful? What strategies have worked best for you? When you've done really well on, tell me something you've done well on, and how did you get there? And all of a sudden, there was this just shift because they didn't realize that they were in control. So, the key is just to start somewhere and build from there. With that in mind, let's talk about the coaching script. So the writable script is available in your handout, and it can also be downloaded from Aquifer's coaching resources page. Just follow the link in the chat. And also note that when a student does share their learning plan with you, there is a link to the coaching resources to get the coaching script, and there is a more extensive coaching handbook that you will have access to. Okay, so now I'm just going to break down the coaching script to explain what we're trying to accomplish, starting with the introductory text. So in the introductory paragraph, we included language intending to encourage a positive relationship. Remember, a positive coaching relationship fosters a supportive environment and promotes learner agency by establishing trust, encouraging mastery goals, and creating safe spaces for low-stakes assessments. Involving students in the assessment process to empower them and support self-regulated learning is critical to this collaborative atmosphere. We've attempted to write the direction into the coaching script. In this statement, the coach focuses on the student, their goals, and their plan. We use the statement, "My basic assumption is that you want to continue your learning journey in this coaching session." And we do that to invoke the growth mindset and to encourage agreement with both the coach and the learner that it's about their learning, not our goals, it's about their learning. Lastly, we include the statement, "This session is not about grades." If the session is about grades, you can expect a very different outcome and a very different response from the student than if they engage in low stakes environment of discussing their learning. Also in the introduction, we put focus on the outcomes that can be expected from a coaching session. The 3 phases of the Anyone Can Coach model are defined in terms of what we hope for the learner. So we want to evoke their awareness regarding their strengths, gaps, and goals. We want to guide their learning or facilitate growth, and this includes identifying steps towards reaching their goal. And then lastly, we want to foster accountability, which sometimes can be the most difficult. In the introduction to this is explicit. It's not intended to be mechanistic, but clear that the coach is there to support them, and they can expect that these outcomes, they will see outcomes if they do engage in the process. And as Kim mentioned earlier, if they come unprepared, then it really not much happens. So under Evoke Awareness, we provide 4 prompting questions, and these are designed to get the conversation started and to help the student develop a strong awareness of their strengths, gaps, and goals. If you're unsure where to start, ask the first 2 questions about their current goals and strengths. Both of these questions are excellent conversation starters. Often when paired with a clarifying question, such as, "Would you tell me a little bit more about X?" Sometimes say, "Will you tell me a little bit more about that strategy?" or "Tell me a little bit more about how that was successful for you." So it's just kind of that exploring a little bit more. You can get a really robust coaching session out of that. Below the conversation starters, we give you a couple of what we call clarifying questions or questions to explore assumptions. But you don't have to follow the script exactly. Sometimes the process kind of goes back and forth. And so you might ask about their strengths, then you might ask a clarifying question, and then you might go back and ask about a gap. So it's not linear. You have to just kind of, I do it as I go along. It's kind of a feel with each student. And what's nice about this is that these questions and the process correspond to the notes section in the student note-taking template. The student is presumably, hopefully, prepared for the coaching session by creating a learning plan, so they may not need to use that note-taking prompts, in the template as much. And also, the student needs to know that they're the note taker and that those notes are for them, not for us. At the bottom of the Evoke Awareness section, we have a transition question. And that would be something like, what are the action steps and learning strategies that will help you progress towards your goals? And I like this question because it helps to move the student from discussing their strengths, gaps, and goals and priorities to developing an actual plan with action steps. The statement transitions the student from reflecting on where they are to how they will make a change. So, I just want to share an example of a student who struggled at first, but eventually identified good action steps. So I met with a student for a coaching session, and they had ongoing struggles. And of course, that was now leading to very low self-confidence. They kept focusing on test banks and just did more test questions. So their action step was, every time I do a set of test bank questions, I'm going to identify what I got wrong and say, okay, chronic prostatitis, that's on my list now. Oh, heart failure, that's on my list now. And so then they would just do more questions. They had a lot of hindsight bias. So when they did it in practice mode and they saw the responses, they said to me, I read the response, I'm like, oh, yes, I know that. And then they also had anchoring bias, so that when they read a question, they would anchor on a word or a phrase. And of course, they would get it down to the famous, I got it down to 2, and then I picked the wrong one. And you're like, right, because you anchored on this word instead of opening your mind up to what are other options. So what we did is I said, well, why don't we look at a different kind of action step instead of saying, and they had such low confidence. So instead of saying, I don't know chronic prostatitis, I said, let's go through a few of these questions. And let's look at your chronic prostatitis. Let's look at the question. Let's look at all the responses. Identify for me what you absolutely know and what you didn't know. Because what they were doing is, by adding an entire topic of chronic prostatitis, they gave themselves no credit for knowing or understanding anything about the topic. And what they did is they realized, I actually do know something. I didn't know maybe these 3 items, but I knew these 6 items. And so they gained some confidence, and they realized they didn't have to waste time studying everything. They had to focus on what they didn't know. So essentially, they didn't know what they didn't know. And then once they used that process, they were much more successful and felt rewarded and ultimately had a good outcome. So, I mean, I know that you've all encountered these students. They breeze through undergrad and they've done really well. Then they get to grad school and graduate medical education and they struggle. And it really can take quite a bit of coaching and motivational interviewing to help that student identify how to address their knowledge gaps and to relearn to study, because their strategies have been so successful in the past. It's hard to let go of those things. The questions in the Facilitate Growth section are designed to encourage the student to reflect on their approach to learning. Do they use strategies based on the science of learning and appropriate for the task, or do they do what they've always done or what others have recommended? Strategies that may be effective for passing a test, but much less effective for integrating knowledge into clinical practice. At the end of the handout is a list of effective learning strategies to share with the students. If you use this list, you'll be very surprised, I think, to see how few strategies most students have and how they apply the same strategy to every aspect of a class, to all their classes and all their courses without changing. Again, they've had success, so they apply it to everything. During some of our recent feedback sessions with early adopters of Calibrate and coaching, the coaches have reported that one of the most important insights for them is that they've learned a lot about how students study and deploy study resources. And this presents the opportunity to ask about a student's openness to consider strategies effective for long-term learning. So it's important to close out the session by asking the student what their strategy is for holding themselves accountable. So before I kind of move on, I'm going to ask Megan, if we're done with the kind of the poll everywhere, whatever that was, the little green skittle, but could you put in the chat, Megan, we have a final poll question. So while I kind of continue on with this slide, if you look in your chat, which is that little box on the bottom right, you'll see what is the most effective way to close a coaching session. So feel free to just freehand it, just respond, whatever you've been doing. And I do think, it is probably for me, the most important piece is, what is their strategy for holding themselves accountable? A lot of times students will shy away from that. And I hear that. I'll get back to you. So note that the language is specific about holding themselves accountable. This is not the coach's job. Although not included in the script, one of the most effective questions, I use it all the time, is by when? By when? Whenever they say something, by when? Put a date by it. So we do know if the student does add a date to their plan and the action steps in their plan, they're much more likely to accomplish those goals. On the student note-taking template, there's actually a series of lines for the student to fill out their action steps and put their accountability. So let's see. I think we've got a bunch of responses in here.
So Cindy, I went ahead and put the answers in and then encourage people to add a reaction or to put their own response in.
Oh, great. Right. So we've got summarizing the discussion, people like that, ensuring the student has an accountability plan for sure, summarize action plan and follow-up meeting for reflection on progress. So a lot of good choices, a lot of good, lots of things, listing action steps. So we've got lots going on there. All right. So before we open it up for questions, I do want to return to the diagram of an ideal coaching session. Every coaching relationship is unique. So use the tools we offer flexibly to meet your students where they are. Expect messiness and imperfection along the way. You want to strive for progress over perfection. And the most important thing is forming connections with students through open and empowering coaching conversations. So a little anecdote for me about forming a bond. This was with a student who was very hesitant by using the coaching mindset. So I met with a student and all they wanted to do was test bank. That was all they had interest in. They were very hesitant to, as they told me, waste their time developing goals and a learning plan. And they were very hesitant and afraid to be held accountable. I kept hearing, I'd met with them a few times and I kept hearing, I'll get back to you. I said, well, by when? When do you want to do this? By when? And they're like, you know what, I'll reach out. I want to try this for a while. And I went along with it the first couple times that they wanted to try it out, but this was ongoing. And every time we met, there was a lack of success. So they really did start to feel desperate the last time I had met with them. And so what I said was, well, when we talk about a learning plan, it's not a strategic plan. This does not have to be a 17-page document. I said, are you willing to take a risk with me? You don't have a test next week. This is Friday. Why don't you make a learning plan? Share with me a learning plan, some goals for this weekend. And then let's have a quick turnaround on Monday. And they actually did that. I said, just that's 73, 3 goals for this weekend. They did that. They accomplished it. We met again, we tweaked it, and they were much less hesitant to follow that format moving forward. So again, just kind of breaking it down, their students are really hard on themselves when they don't perform well. And, often as a coach, we need to help them focus on, small successes, small victories that demonstrate progress. And so just keep it small, keep it simple. And so with care for the learner and commitment to growth, we can expect students to develop the personal characteristics of that master adaptive learner. So with that, we're going to open it up for questions. Okay, so we have Q&A, we have the chat. You want them in the Q&A? Or they can do the chat, right, Megan, either way?
Yes, either way, we would love some questions. Kim and Cindy are ready.
Mm-hmm.
And I'm ready to highlight them. Okay.
I see Corky had a good response to our last poll. Corky says, offer a follow-up meeting or email exchange after the student picks a date to wrap their action plan. That's really good. Thanks, Corky.
So Marcy put in tips for moving students past the obsession with grades. I need this for my 11-year-old. So what tips you got?
Cindy, you want to go first?
Yeah, so I always kind of start with, I try to keep it light and say, so when you're at the bedside, remember, no patient has ever said to me, I have A, B, C, all of the above, or A and C. I said, it is about relationships. It's about knowledge. It's about continuing to expand your knowledge. So, part of the problem is it's our fault. We keep giving them grades and we reinforce grades. But I try to use the successes with it's about what you know. No patient ever asked me for my transcript. They never asked me for my grades. So, you just kind of have to reassure them with that. Ultimately, I'm like, yes. And because they'll say to me, grade, we can't do this without a grade. I'm like, correct. But let's not focus on that. Let's focus on, you just have to distract them from that grade. So I try to find some small success because usually when they're focused on the grade, it's because they have such low self-esteem and low confidence in themselves. So I try to find something where they have confidence. If they gain confidence in themselves, then they can move beyond that, because that's not where their focus is. Their focus is, oh, I can do better. Go ahead, Kim.
Yeah, I kind of just go back to that evoking awareness. What does the grade get you? And kind of just dig deeper about, what their ultimate goals are, and perhaps some process measures to get to that goal. Because I think if I can get them to have that aha moment where they say that, if I focus on the process, this will all work itself out. And it'll be a much more joyful process that in the meantime, I feel like I've done my job as a coach.
Yeah. I use the term their ability to go from head to hand. I said, when you're at the bedside, no one's asking you to recite, Harrison's from chapter and verse. What they want to know is that whatever's in your head, you can apply to what they've told you and help take care of them. So, a grade does not do that, but you have to be I always like to talk to it about what happens at the bedside, because that's not a grade. I said, the biggest grade you're ever going to get is from your patient. How did you do in the care of the people that you're taking care of your patients? And so trying to distract with, maybe, who cares? It's a B, whatever, who cares about that? But when you're at the clinical and you're at the bedside and you're able to make that diagnosis or listen to that patient and garner information that no other provider got, that's an A. It's an A plus.
Okay, popped another one at the bottom of your screen.
Go ahead, Kim.
Yeah. So what do you do when the student's still performing below the mark after the second assessment? So I think first it's just to, maintain the curiosity of what did they do to prepare? How did they feel their preparation went throughout their clinical learning, as well as the supplemental resources that the course provides, that Aquifer provides. And often I'll find that they didn't put in the work. And so, we can talk about like, well, what would be expected, to have changed if sort of the work wasn't done. There are other students that I think, they made some progress, but they started really behind, and they, are still sort of behind compared to their peers. And that's, Aquifer will, or Calibrate will sort of, benchmark them on their peers. And so there they need like a longer, off ramp. They need a longer on ramp to their learning. And we find that all the time, that this is not about treating every student equally, but equitably and meeting their needs. And so that's where, you can advocate for them. If they're putting in the work and they're making progress, I feel much better about that student's like, okay, a little more time, a little more work, and a reassessment is what we need, and go from there. And so, yeah, not every student is going to get it on that like artificial timeline that we've perhaps made for them in medical education. But more times than not, if they're not making progress, it's because the work wasn't done, and they kind of see like, okay, now let's see what happens if I do put in the work and reassess.
Right. I would agree. And then the other pieces, I go back to the basics of, so tell me what strategies you use, what do you find successful? And, when they're using Anki over and over and it doesn't work. Anki worked in anatomy, but it's not working in a clin med course. Again, they're doing the same thing over and over. It's not a successful strategy, because sometimes they'll list for you what they say is successful because it had some success somewhere. And so I like to review that and say, having a lot of different tools in your tool belt are fine. If that same strategy works throughout, that's good, but it's not working here. So I go back to those basics of reviewing, what is their strategy and what is their action plan? Because like Kim said, 9 times out of 10, they started strong, but then they went back into old ways and they just didn't put in the time or effort.
Joe's
Next
giving a
question: are there
question.
certain types of students you found benefit the most from coaching? I'll say
You want
that.
to do that one?
Yeah,
Go ahead,
no, I
Kim.
can start.
Yeah, no, you go.
Yeah, students, I think, that either have an openness and curiosity, or perhaps a preconceived notion that coaching works. They're often really fun because I think, again, they're open to the process, and it's easy. But I would say sometimes the most rewarding are the students and the learners who really, like Cindy had mentioned in her example, had already decided that this is not for them, that it's a bunch of fluff. And it's, I think, the subtleties of the conversations and maintaining curiosity, maintaining patience, and avoiding any judgment. usually can sort of bring them around that, like, we're just relationship building here. And with that, let's agree that we both want the same thing for you, is we want you to progress in your learning journey. And perhaps some planning and some strategizing to help you get there is in your best interest. So I think a lot of patients for when they aren't already bought in, but it can be really fun because they inevitably, I think, have that light bulb moment where they realize there's value. And if nothing else, they've, developed a relationship with someone they trust as an educator.
I would agree. I think it's any student, wherever they fall with their learning ability, as long as they're engaged in the process, they learn from it. Even, students who are strong learners who can figure almost everything out by themselves, they enjoy it because of the challenge. They're like, oh, just another new way to learn. And they enjoy kind of that process. So, but I think, when I look at what student in like our program would benefit, of course, our struggling students, it's helpful for them because they don't know what they don't know, and they're losing confidence, or they've got that overconfidence. They think they know something and they don't. So they do benefit, but it's that middle learner, the learner where, they're getting their grades okay. They surprise you with the failure on a shelf exam, or God forbid they fail, the boards. And you're like, how did that person passed everything? They were a nice student. They did well. They may not be the top student, but they were fairly solid. Is because they kind of got by, and you didn't realize that those B's, or those getting bys, those high passes, were just kind of gifts. And so they can benefit because they just deepen their knowledge on how to learn, and how to, it moves them into life, like how to think clinically and how to become a master adaptive learner. So they're often the forgotten group, the middle child syndrome, right? The excelling learner, they're like taking off. The student who struggles, we're all running to them. But it's that middle child who doesn't get a lot of attention from us, but really could benefit from this because it steps their game up for them without a lot of effort.
I want to highlight a question that was put in the chat. Corky, do you want everyone to answer this? So, do any of your programs require coaching for students in academic difficulty? Just curious if that happens anywhere. So, perfect.
Yeah,
Corky
so I
says
think
anyone can answer.
feel free to answer the chat, or it looks
Yep.
like yes from Corinne. We offer coaching to all of our students. So every student gets a coach. Every coach has 6 to 8 students in a cohort and follows them all 4 years of medical school. And they are involved if the student does develop academic difficulty. But it's interesting because I've been asked to coach faculty who have clinical difficulties or difficulties with their efficiency in the hospital. And that is a new, there's like a variable response, because you can imagine the older you are, maybe the less attuned you are to the benefits and processes of coaching. And so many of them come into my office worried they're in trouble, worried that I'm there to judge them or to, fix them. And then they're pleasantly surprised by the end of it. So I take that as like the faculty correlate of academic difficulty. I've been doing some coaching there, which has been interesting. But at our program, all students have a coach. So. Yeah, so Joe mentioned that, just having a coach, you can identify students that are struggling. And I would say not just from an academic standpoint, but also from like a personal standpoint, from an adjustment standpoint. Those check-ins with someone, especially longitudinally, you can see that someone who maybe, started out the year strong and then something changed. The coaches are really good at picking those up. And also not just, helping to be there for a learning plan, but maybe an advocate to find resources or.
Right.
Yeah.
Because usually, like in the PA world, when the students enter their clinical, even in a class of 50, the 50th student is still doing well on their first rotation as a rule. I always say every third rotation, every, 3 to 4 months, the students, I tell them that, but they don't realize the game steps up. So if you're performing on rotation 9, the way you did on rotation 1, those evals are not going to be the same. Your ability to, what you're allowed to do on that rotation will change. So I think that's where coaching also has a benefit, is that you can help them step it up. Like, oh, I did fine in rotation 1. So, I'm just going to do that for the rest of the clerkship, for the rest of the year, whether they're a med, PA, or nurse practitioner student. So kind of helping those students who would just kind of settle and not understand that you got to step up. It's like a ladder.
Again, anything else?
I'm not seeing anything else. Any final questions from anyone? Comments? This was a really great session. Thank you both so much.
We really
Thank
appreciate
you.
everyone for joining and participating with our poll questions and participating in the chat. And
Yes.
your questions.
Yeah, this was a great chat today. Very engaging.
And hopefully you'll use that script. Just use it loosely, just put it in your tool belt. Put some of the questions in your tool. Yeah. Doesn't cost anything, and you'll be surprised sometimes at the outcome.
Absolutely.
Thank you, Megan.
And if anybody wants additional support, we had the Calendly link, so you can definitely schedule a one-on-one meeting, and we have lots of resources. I will make sure all of the links that we shared today and the handout get sent to you with this recording, so that you have that, and feel free to reach out to us. Joe always likes to put his email in, joseph.miller@aquifer.org. And we will be happy to help. So thank you both so much today for your insight and wisdom. And we look forward to seeing everyone soon.
Thanks.